from posters to prizes, physical activity, health, well-being, and behavior change interventions in the workplace. So before I get into more of the research side, I just want to ask you this question. What is the most dangerous activity that we all do every day in the workplace, but also more generally at home as well? Yeah? Sitting? Yeah?
Inactivity.
Inactivity? Yeah? Anything else?
Stairs.
Look, walking up the stairs? Okay, yeah? One more? Working? The lack of sleep? Yeah? Okay. But I think the first answer was sitting. Sitting is one of the most dangerous activity that we all do every day nowadays, right? And we'll kind of explore it as we go along. So therefore, I know we just had a break, and I hate to ask you to, if you can, to stand up and play this game with me. But so if you don't mind, and if you are able to, if you can stand up. So the game is, have you ever, right? So I'll pose a question, and if that question applies to you, if you did that, what I've asked, all you gotta do is just raise your hand, look around who else got their hand raised, walk to them and give them a high five. Simple as that, right? So question number one is, have you ever been late to a classroom or a meeting or a teaching class? Yeah? Let's now run around, walk around, run around, whichever. Find someone. Yeah? Now, the next question is, we are into the era of social media, mobile phone technology. Have you ever used mobile phone whilst in the bathroom? Or in the, yeah? You a high five? Walk around? No? There you go. Paul is coming. Brilliant. Now, thank you very much. You may take a seat. Thank you. Now, that almost 2 minutes activity, what did it do to you? It broke or broken your sedentary behavior to a more active type of behavior, but also it brought a laughter into the session as well as the life. And that does contribute positively to our health and well-being as we go along. Now, we'll explore the sedentary side of it a little bit as we go along, but if you can, every hour or hour and a half, try to break your sitting behavior and just trying to stand up and walk around if you can. Now, into more so the research, we know that the benefits of participating in regular physical activity are wide-ranging and they're well accepted across the spectrum. But yet, physical inactivity is increasing, especially among adults. Some benefits of engaging in regular physical activity are to reduce coronary heart disease, diabetes, obesity, musculoskeletal disorder, as well as anxiety and depression. We know that in the UK, there are over 30 million adults in either full-time or part-time in employment. That figure might have gone slightly higher now, since that figure is from 2022. However, the occupation or the workplaces are now becoming more sedentary due to the enhancement of technology and also the machinery and other demands of our work. And that then leads to contribute to an inactive lifestyle, and then that also contribute to the unhealthy behaviors and health-related problems. A couple of years ago, over 137 million working days were lost due to sickness absence from workplaces. Now you can imagine the impact of that on the workplace, as well as the wider economy, but also on the health of the individuals who had to take those days off. We know, and the research have shown, as mentioned earlier, that engaging in regular physical activity can positively contribute to all causes of morbidity. So, before my research and the interventions that I've delivered, when I reviewed the literature in the workplace, these are some of the gaps or the problems that I have encountered. One of them was that most of the existing research has applied self-reported methods to collect the data. Now, colleagues before me talked about some different methods, clinical data, and some other quantitative data as well. So we know the pros and cons of that. But also, research have failed to evaluate the current physical activity levels and sedentary behavior prior to delivering the interventions. So for example, if I came into this room and I say to every one of you, I'm going to get you all active and healthy, and here is the music, let's dance to it, for example, or let's do some jumping and so on. Maybe for a minute or two or 5 minutes or a week or so, you probably might engage. But after that, the interest is going to vanish and you'll no longer want to do it. So why? The reasons we need to figure out first before we introduce something to people. Also, we were unsure if the interventions has actually enhanced physical activity level or health or well-being because the baseline data were missing in most of the research. Another gap was that most researchers have identified that the workplace or workplaces as a homogeneous group, as a one group. And we know that one-size-fits-all approach is not ideal. In workplace, we have different people, age-wise, gender-wise, ethnicity-wise, cultural-wise, and they all require some sort of tailored interventions. So overall, there was lack of comprehensive and systematic interventions to improve physical activity, health, and well-being in the workplace. So the aim of my project was, and still is ongoing in some instance, to understand the current physical activity levels, sedentary behavior, barriers and facilitators of university employees prior to delivering the interventions. So as part of it, I've conducted 3 baseline studies. Study 1 was to evaluate their current physical activity levels and how much time they spend sitting every day. Now that was self-reported data. Those of you who may be familiar with International Physical Activity Questionnaire, so I've used that and added some more questions to it, looked into their nutrition and some other aspects as well. In order to validate that and to find out if they have actually over-reported or under-reported the data. So what we did, we've used a tool, objective tool called Actigraph, which is like a watch, a kind of pedometer, but it has almost 99.9% of validity and reliability. So we kind of track their heart rate by giving them a heart rate monitor, as well as their sleeping and their physical activity, their sitting and their calories intake and everything for a whole week. So we can kind of compare it with the previous study. When we did that, we also, alongside that study, we used the IPAC again so we can make that comparison. And then that study then informed another study, which was a qualitative study to understand the why of it. So the barriers and facilitators to physical activity amongst employees in the workplace. So these 3 studies have led me to 5 interventions, which 2 of it I will explore today, and the 3 I will select for the future. Hopefully in a year or so, we'll get another opportunity and present. So one intervention was getting university employees on the stairs, asking them to use the stairs rather than lifts. And then another one was a team-based competitions amongst employees for the 10,000 steps challenge. And there was a prize at the end of it for the winner team. Methods were the study 1, the baseline was quantitative. Study 2 was also quantitative. Study 3 was qualitative, pure qualitative study. And 1 intervention was quantitative and 4 were mixed methods intervention. But we'll focus on the 2 interventions today. So overall, the whole project is a mixed method project. In study 1, we had 400 employees. And as you can see, male and females as per breakdown. In study 2, we had 64 participants followed from that study. In study 3, we had 41 participants. And then here, we kind of divided them into active group and inactive group. So active were those who were meeting the physical activity guideline of and approximately 150 minutes across the week or 10,000 steps, etc. Anyone who did not meet the physical activity guideline, we classified them as inactive. But the set of questions posed to them in study 3 were the exactly same questions. And then the study 3 kind of informed the interventions, which the first intervention had 103 employees, and the second one had 49 employees, but 8 groups, which we will explore in a minute. So this is study 1. That's been published some time ago. And then this is study 2. So we kind of looked into the physical activity levels. And then we also looked into comparing the objective and subjective tools to see what they were saying was actually a true reflection of what they were doing as well. Now, this was the third study, the barriers to physical activity of employees. Now, this study, I'll share the results with you. Here are, and some of the results may kind of, you can apply to yourself by thinking and say, so one of the common barrier that was reported by employees to participate in physical activity or health was lack of time. Now, that applied to both groups, active and inactive groups. Another one was family commitments, motivation, weather, and then workplace barriers. Now, workplace culture. Some people say that if I walk, colleagues does like judge me while I'm walking, or if I'm taking a bit of an extra 5 minutes or 10 minutes break, the management support isn't always there. Now, the management support was one of the most commonly reported barrier as well. We then had lunch break. So for some of us in the workplace, for example, academics, they probably might have a little bit more flexibility compared to professional services colleagues. So therefore, they were complaining of lunch break and saying we have half an hour and we have to take it between 12 o'clock to 2 o'clock. If we don't, we're going to lose it. So how do you expect us to eat and also do some activities? Flexibility and resources. But the most, if I could pinpoint here, access to gym on campus. The university where I did this project do not have gym on campus. So that was the kind of mostly reported barrier. And as you can see, I think it was reported by 37 people out of 41. Or activity classes or flexibility. Now that was across both active and inactive groups. But when we further broken this down, the first table here are colleagues who usually commute to work. And we asked them, how do you commute to work? Do you take active commute, public transportation, or driving? And as you can see, most of them were taking inactive commute, and then they were saying they're trying to find the closest or nearest car park spot to their office. And then environmental support. Environment is not supportive. Tiredness, busy life, cost, gym cost money. We're quite lucky in this place. I think they provide free activities and gym access as well. Like-minded people. Sometimes if you are into exercising or health or well-being and the people around you aren't, that has a knock-on effect. Pressure, and some of them say that health and well-being is not valued in that particular workplace. And then autonomy and protecting time where they can do exercise, that was reported as a facilitator. And the table here, road safety, enjoyment, positive attitude, these are some of the themes and sub-themes reported by those who are already active. As you can see, the difference between this. So we didn't have the fund as well as the time to open a gym and monitor that and to see if that works. But what we did some alternative, we selected an alternative approaches. So we're trying to promote workplace physical activity through the impact of motivational and educational barriers. Now, what I did, we placed banners in front of the lifts just to see if that can help motivate and change employees' behavior. Now, this was a mixed method observational study. As we mentioned, 103 employees participated, and the intervention was for 12 weeks. It was survey and covered kind of a approach where I sat down by where the staff could see me, but they can't see what I'm sitting there. So I'm just working on my laptop or writing a note, and I'm seeing someone approaching the lift, and they're seeing these banners, which I'll show you in a minute. And if they take the stairs, and I see them, they're climbing up the stairs, then I will follow them. As I follow them, they reach to the first kind of a floor, and I say, hi, how are you? And then I'll have the conversation and say, would you mind, completing the survey, and why did you take the stairs, and so on. And that's how we recruited the 103 people throughout the 12 weeks. These were the banners that were displayed. Now you can see they're quite colorful, attractive, and colleagues mentioned, for example, lack of time. That was one of the commonly reported barrier. So what we said, you got a minute, take the stairs. And then there's a small message, aim for 30 minutes of physical activity a day. It doesn't have to be all at once. You can 5 minutes now, 3 minutes later, 5 minutes later, and that's almost half of your goal is achieved. And then can't get to the gym, take the stairs. Taking the stairs is actually helpful to your muscles, and it can help. And again, we got a message there. And then feeling down, say take the stairs. It helps with your mental health as well. And then as they reach to the next floor, we have the other banners, which says, well done, stair climbers. You're kind of getting towards your healthy and so on. And that kind of motivated people to change their behavior. So from the 103 people, 84 reported they noticed the barrier. The blue ones, as you can see, and 54 people reported that the banners actually influenced them to take the stairs. 68 felt physical, and 66 people felt mental benefit of taking the stairs. And 88 people mentioned that they want the banners in the future as well to be displayed across the other campuses as well. And on average, they took 3 floors, and I think each floor is 23 steps. So that's just at once, and then throughout the day. And this is some of the qualitative findings that came out from the study intervention, and you can see motivation. So it motivated people to take the stairs and change their behavior. So promoting physical activity. After seeing the banners, I now use the stairs to walk and move more when I'm at work, so I can stay active. Physical benefit. People have started to see the physical benefit and also the mental as well. And if you look into the behavior change, people are saying that it made them aware that a little bit of changes can actually go a long way, and it adds up. And also the future direction. So they wanted this intervention to prolong and to be extended to other buildings as well. Now this study, fortunately, was published last month, I think 27 April, yeah. And I think maybe Romy can share the slides if any of you wants to kind of look into that study. So this was published last month. And the second intervention, The second intervention was incentivize physical activity, intervention promoting daily steps amongst employees. So this was a team-based competitive intervention. And there was a prize at the end of it for the winning team. And then, it was mixed methods. 49 employees across departments, 8 departments participated. And as you can see the table here, the grey, we had senior admin management. If you remember, in the study 3, participants said the management is not supportive. So what we did, we reached out to the management and said, if you can help, participate and see if that actually helped. So we had the senior management, we had educational and social work department, nursing and midwifery, sport and exercise colleagues, whom I'll show you the results and you'll be shocked to see. Yeah. And health sciences, admin assistants, library and IT. So for the first week, we collected the data as a baseline, and then it was 7 weeks intervention, and each department had to compete with each other. And then each week I had to send them the score and the results, how much walks they have done, how many points they got, and who will win at the end. So here is the data. The black bars report the steps taken prior to the intervention. And the grey bars or the white bars shows the steps during or post-intervention. So the baseline steps taken by employees before the intervention was recorded at 5,959 steps, which means they do not meet the daily steps guideline. In fact, they're more likely or they're close to be just lightly or in a sedentary kind of guidelines there. Whereas the intervention data has shown that the average employee's daily step has increased to 10,758 steps. So that has actually helped improve their steps per day. Now, I think I had a picture. This is the picture of actigraph. Each team had one actigraph. So, we did that for a reason. We didn't give it to each individual member within the team. So we gave one actigraph per the team, and whoever was kind of going for a walk, the whole team will go and to see how much walks they do and so on. Now, the findings from the qualitative analysis, again, the 5 main themes that emerged were motivation. We as a team, colleagues mentioned, never go outside or at a lunchtime. But with the challenge, we have tried to do this every day. It motivated us, the whole team, to go together, improve cohesiveness, improve communication, and so on. Team working as well. It was competitive, but same time, it was very enjoyable intervention as well. And it was a positively and friendly competition amongst the colleagues. It did make them active, as you could see by the results, but also they said their productivity enhanced. And that's what we want. Don't be like every one of us. We come to work sometime, and I tend to have this conversation with the management as well. I say, do you want someone just in front of a computer to sit there, their presence, or do you want them to work? If you want the productivity, give them the autonomy that they require, and of course, hold them accountable, but they'll do the work. So their productivity increased. They're saying, even though we went for a walk around the campus or outside, but still we managed to get our work done. So that's again, it shows that exercising or physical activity engagement can help you be productive. But also those of you who are students, it helps in actually the academic achievements as well. Also, again, the behavior has changed. People were saying they've noticed colleagues joining gyms membership, so they can go gym. They started cycling, they started walking. In fact, one participant told me he actually sold his car and he's now cycling to work and he's feeling a lot more better. And he said all of that money that he used to spend on car, the driving, the insurance, the fuel, everything, that goes to his daughter's saving account. How good is that? You get your health as well as you save some wealth. So we say health is wealth, isn't it? So here you can see by the data. Now this study was published I think early last year as well in Frontier. We had Gulrays and Sanjoy from here as well. So you can read more about this study here. Now, the future direction, what we need is to make it more impactful. We need follow-up studies and long-term studies to see the impact in the long term, but also we need to kind of assess if the impact of these interventions are still positive once the interventions are ceased, right? So that's what we need to do now. So intervention 3 is the accessibility and the availability of exercise equipment or resources in the workplace. Again, as I said, I can't open the gym. So what I can do is I'll show you a couple of pictures. So these are my pictures, but as you can see, these are staff offices, and all I've done is placed a rower or concept 2 and a mounted cycle just to see if this can get people active. And so far, the results are showing to be positive, and we measure their health and their well-being through some questionnaires, pre and post as well. And also, another intervention is promoting more active behavior in the workplace through sit and stand provision. Now, when I was here working at University of Westminster, I had standing desk. At home, I have standing desk. In my current workplace at Birmingham City University, I have standing desk. And we are now trying to change that work culture, that sedentary is like the new smoking. It literally slowly it impacts us and can ultimately take our life. And the 5th intervention is exploring the impact of seated, standing and walking meetings. Now, we figured out from the previous findings that staff were saying they started to incorporate walking meetings. So what I did, I gave them access to botanical garden. It's a nice garden we have close to our university, so they could go there and have their meetings if they could. And that has been found to be really positive thus far. The seated meetings was reported to be less effective, and staff reported they were actually angry and disappointed and didn't want to be there. Standing one was reported that they were a bit tired, especially they were not used to standing for too long. But the walking one, they found to be more energetic and they were more alert. And they also reported that they were more creative as well. So we know that movements create some sort of creativity. This is a standing desk in my home office. So now, what do we learn from all this? We learn that supportive environment plus social interaction and motivation can positively change behavior. We also learn that workplace or community-based health and well-being intervention must be complementary or balanced so that they make sure that you look into the needs of individuals. And as one-size-fits-all approach does not work all the time. The practical implications we can take from these interventions are that we can actually extend it to other workplaces as well as communities or in shopping malls as well. We can display these banners, we can do this walking and so on. Yeah. So my final takeaway for you is that small actions can actually create big cultural differences and shift positively. And also, when you are coming up with interventions, make sure you design for simplicity, inclusivity, and motivation, as well as trying to improve the discipline of people to change their behavior for better. That's it from me.